I'm Ursula Sansom-Daly at Prince of Wales Hospital. I'm a clinical psychologist within Sydney Youth Cancer Service, and that's a service that treats and supports 15 to 25-year-olds during their cancer experience. And I also hold a role as the director of the Behavioural Sciences Unit at UNSW, which is a big interdisciplinary research group, again dedicated to the psychosocial, ethical and behavioural aspects of cancer and other illnesses for children and young people. Yeah. I think I've always wanted to be a psychologist since I was even a Year 12 student. I don't know why. I think I've always been interested in people, what makes them tick, and sort of also how we support people when they're going through tough times. And in terms of what brought me into that field and intersecting with cancer, I think it's such an interesting time of a person's life and a challenging time of a young person's life, because obviously being a young person is tough enough, just evolving as a teenager into an emerging adult and a young adult. And I think from a psychological perspective, there's so much that we can do to help them, equip them with skills to navigate that whole process. And it's also a time of opportunity, because I think if we can help young people at that time point to learn some new skills, to navigate those challenges, those can be skills that they actually take forward, hopefully for the rest of their lives. So it's an exciting time to be working with a young person. A lot of research over the recent kind of 5-10 years has started to uncover that, although we kind of think about a diagnosis of cancer as being a crisis when it's diagnosed, actually for many young people and families, what they were telling us is that it's actually that finishing treatment time point that can be quite tough, and that's not necessarily what they were expecting. It's not what their family and friends would expect. You kind of start to look better, everyone thinks, oh well, that's done, go off and go back to your regular life. And what we have seen with many of our young people and families is that can represent a time when distress can peak a little bit again. It's actually at that time point often when young people start to kind of grapple with what has actually just happened to me over this past 6 months, 12 months, 2 years. It's when they start re-entering all those old social groups, their old routines, and realize, maybe I don't feel quite the same as I did before. And it's also the time when young people and families sort of move a bit away from those hospital supports. And, some of them will describe, the people at the hospital almost like becoming a second family. And screening processes and support processes to the young people who are showing us that they are having the most troubles and that they're most at risk. And so we're going to be tailoring that support service through a new tailored neuropsychology role that will be built into our research grant. And then we're going to be assessing young people, during and beyond their cancer treatment to see which are the young people that are showing that they're having the most psychological impacts, the most cognitive and neuropsychological impacts. And that's going to help us into the future to better identify and tailor and target support to those young people most at need. Well, working with young people with cancer and other serious illnesses has been my focus over the last many years. And I think, the good news story, I suppose, is that young people can be really resilient. So mostly on the whole, we see young people, not to say that it's not a massive impact and a big challenge to go through something like cancer or another serious illness, but we do see how resilient young people can be, how adaptable they can be, and for the most part, young people do travel on to go well in their lives. I think we do have significant issues for young people, during and after cancer treatment, particularly for that impact on their social and peer relationships. For many young people, going through cancer can, mean a huge amount of time out of school and out of work and out of their usual activities. And if you think about it, for a young person, that is their job, to be going to school, to be going to sports and all that kind of stuff. So those kinds of social impacts are a big challenge. In terms of the mental health aspects, I think, in some ways, they are similar to the mental health challenges for young people in general. So anxiety, stress, depression, for some young people, they can find that they are quite susceptible to worry and to worry, or it can be called fear of cancer recurrence or fear of cancer progression, the cancer getting worse. And so for some young people, that comes up as a big concern. And in some of the other work that I've done, one of the things that's been interesting has been looking at young people who might have gone through their cancer treatment quite well and quite successfully, but some of them can still have challenges in, I suppose, moving on to what does life look like now. And so in some of the research that I've done, we've shown that some young people have trouble really being able to then visualize and envision, in a really clear way, what does life look like beyond cancer, because it has such a massive impact on their identity. Probably one of the most meaningful people and patients that I was able to work with the past year was a young woman who, unfortunately wasn't able to survive her cancer in the end, but she was the most amazing young person and just really took life by the reins. And what we were able to do together was really have very open conversations about what all of that meant to her. We used one of the research and clinical tools that I've developed, Voicing My Choices, to help her navigate what does it mean if my cancer is not curable, and what matters to me now, and what's important, what do I want for my care at the hospital, and what do I want my doctors and nurses at Prince of Wales to know, and what do I want my family and friends to know. And one of the coolest things that we're able to organise with her was we were talking about the idea of the hens night, and the how it's always kind of this fun thing that you do where you bring all these people in different generations of friends and maybe women together. And she wasn't engaged to be married because she was still a young adult, but we kind of conceived of this idea for her that she was able to, have this hens night just because, as a celebration with friends and family. And that was something that she did, and it was amazing for her. And so they're the gems, I think, when you're working with a young person, is actually really, it's not what I bring to the table, it's about what we develop together, understanding who they are and what they're wanting, and then working with them to kind of work towards those goals can be amazing. And I think that's what keeps everyone in our team going, really, at the Youth Cancer Services, whenever we're able to support a young person to achieve their goals, despite their cancer, that's amazing.